Every year there are more than 28,000 hospital admissions due to severe heart attacks. Afterwards, patients often develop symptoms such as fatigue, shortness of breath, and chest pain. Of those who end up in hospital due to the so-called heart failure, roughly half die within 3 years. Researchers on the CellBeads project are focused on helping the heart recover from a heart attack. They are using special stem cells, the building blocks of the body that can develop into all kinds of tissue. Their main focus is on the beneficial proteins produced by these stem cells. The stem cells have been packaged in CellBeads, microcapsules made of a safe plastic that do not trigger any kind of immune response in the body. A myocardial attack is caused by fat and body cells that accumulate inside a blood vessel, which causes the vessel to narrow. This can induce a heart attack when the so-called plaque ruptures, leading to the formation of a blood clot that can restrict the flow of blood to parts of the heart. These parts become impaired. The rest of the heart has to work extra hard. As a result, the heart swells over time and the volume increases. The systolic contractile function of the heart deteriorates. With every contraction, insufficient oxygen-rich blood is circulated throughout the body. In the heart muscle that has experienced a heart attack, there is little oxygen and extensive inflammation, and thus many cells are not able to survive and die. Consequently, therapeutic stem cells that enter this part of the heart without CellBeads survive for only a few days. By packaging stem cells in a CellBeads shell, the stem cells are protected against the immune system and receive nutrients, so they continue to work for a few weeks. The CellBeads are introduced into the bloodstream by infusion. They then travel to the ends of the smallest blood vessels in the region of the infarcted heart, where they release their proteins. The stem cells cannot leave the CellBeads over this period of weeks, but the released therapeutic proteins can. This process helps the damaged heart tissue to recover. In the future, thanks to the CellBeads project, many patients will be able to recover from a heart attack without developing heart failure.